Hello, my name is Paul Garrett, and this is a pre-recorded presentation for the 2021 meeting of the Australasian Mathematical Psychology Conference. Now, I'll start by saying this isn't a typical math psych talk. There is far too much data and far too little math, but I hope you find it interesting all the same. Now, COVID-19 has changed how we live and work. In Australia, physical distancing, lockdowns, mask wearing, and working from home have all helped to suppress the virus's spread, while efforts by state contact tracers have ensured close contacts of infected individuals are rapidly notified so they can self-isolate and contain the virus. The often asymptomatic nature of COVID-19, combined with its high rate of transmission, has meant that some contact tracing teams have been overwhelmed, especially in countries where restrictions to public mobility were not put in place. Now, COVID-19 tracking technologies speed these contact tracing efforts, but they require mass uptake among the population. To these ends, we conducted a series of surveys across the world and within Australia, depicted in green on this graph, to see if people would use any one of three tracking technologies before comparing these attitudes to actual downloads when national tracing apps were released. In our study, participants completed a survey that asks about their perceptions of the pandemic and the efficacy, risks, and benefits associated with one form of tracking technology. The first tracking scenario involved telecommunication tracking. Now here, mobile carriers are notified to seek testing if they are within network radius of an infected individual. The technology applies to any phone carrier, making it a mandatory form of tracking. A real-world example of this is Taiwan's electronic fence. Now, second technology is a centralized government Bluetooth app. Bluetooth tracking is limited to a small radius and only registers phones with compatible apps. A centralized app constantly sends registry data to a central repository that can be accessed by the health department, and this can facilitate manual tracing efforts. For context, COVID-Safe is a partially centralized system, as health officials only get your data if you volunteer the information. Our final technology is a decentralized Bluetooth app. Decentralized apps work phone to phone, and they notify individuals directly and do not facilitate manual contact tracing. The Apple-Google exposure notification system that forms the backbone of tracing apps in the UK, Germany, and Spain are all decentralized systems. When world governments announced that they would be releasing COVID-19 tracing apps, we modified our survey to ask about the effectiveness, risks, and actual downloads of these apps in Australia and Germany. Now, each survey was roughly designed in a similar fashion. Where possible, we collected nationally representative samples and asked them about the threat posed by COVID-19 before describing one of three tracking technologies. Participants then gave their responses to how effective, harmful, and acceptable these technologies were. Participants who didn't think that the technology was acceptable were asked follow-up questions. Namely, would they accept the technology if data were deleted after a 6-month sunset clause? Would they accept telecommunication tracking if they could opt out of being tracked? And would they accept the government app if data was stored locally and not on a government server? Finally, the survey concluded with items regarding worldview. Now, when government apps like COVID-Safe became available, we converted these surveys over and asked about people's understanding of the app's technology, whether they downloaded the app, and why or why not. The remaining questions regarding the impact of COVID and the tracking benefits and risks remain mostly the same. Now, in Australia, we collected 4 representative samples, 2 for the acceptability survey and 2 for the COVID-Safe app. We sampled roughly 500 participants per tracking technology, and our sample was skewed towards university education. That's my friend getting a COVID negative test. Here we have results from the acceptability ratings. We see a majority of Australians were accepting of all 3 technologies at baseline, and their acceptance improved with the inclusion of a data deletion sunset clause. as well as an opt-out option and a local storage option. Privacy matters. However, when we compare these results to actual usage of COVID Safe, we see a gap between the intentions and behaviors. People were far less willing to download COVID Safe once it became available than when they were initially surveyed. To explore why this gap occurred, we modeled all of the responses for both the acceptability and COVID Safe surveys. And rather than walk you through this, we'll skip to the findings. What we see is that acceptance ratings improved if you knew someone who had contracted COVID, you believed in the technology's efficacy, and you trusted the tech would preserve your privacy and security. By contrast, acceptance was inhibited by the perceived risks associated with using the tech and the difficulty in declining participation. Now, the same modeling of COVID Safe on the right shows that usage improved with age, the ability to use the app, belief in the app's efficacy, government approval, and belief in the app's data security. By contrast, COVID Safe usage was inhibited by believing others were not following government policies, believing the app would not reduce the spread of COVID, conservative worldviews, belief that science has not helped society, and misinformation or poor decision making. And I say this because it's not quite clear which one of these is occurring. So, before telling people how COVID Safe worked, we asked them to report what technology they thought the app used to register nearby devices. A majority of people who had downloaded the app correctly reported Bluetooth. However, among non-users, responses were divided between Bluetooth, not knowing, and GPS locations. Furthermore, a quarter of people who said they would never download COVID Safe reached their decision without learning anything about it. That raises an interesting question. How much of this finding is due to misinformation? And how much is due to people being unwilling to engage in informed decision-making? Continue to think about that as you look at Germany's results. Here, we asked participants the same question regarding the Corona Warn app, a decentralized Bluetooth app. As you can see, the results are nearly identical. What's really interesting here is that when this data was collected, Germany was in a very different place from Australia. While Australia was in a national low for COVID cases, Germany's cases were sitting at about 2,000 per day in the first sample and 20,000 per day by the second. Even then, Germany still showed lower acceptance overall than Australia and fewer downloads of the national app. Now, we've only recently acquired this data and we're still going through the modeling, but it does appear that COVID cases may not be entirely driving acceptance and usage of COVID-19 tracing apps. Well, at least in Germany. To show what I mean, let's have a quick look towards Japan and Italy. Now, Japan and Italy have had very different experiences during the pandemic. Japan had low case numbers, and Italy had thousands of cases per day and thousands of deaths. Now, what's interesting is that our data suggests concern for oneself, for others, was still higher in Japan than in Italy. What's more, there was more trust in the government, their intentions for the data, and the privacy of the app in Japan than in Italy. However, none of this seems to have translated to app acceptance. Instead, we see a majority of sampled people in Italy are accepting of the government app, while attitudes are reversed in Japan, with acceptance not even reaching 50%. It could be that case numbers and lived experience, that is, knowing someone who has had COVID-19, are driving acceptability ratings, but it's difficult to know without further modeling. And so that brings us to our last step. We've now collected data in 9 countries with very different attitudes towards these tracing apps. Some countries are very accepting, such as Italy and Taiwan, while others are not so, like America. Now, clearly, judgments regarding COVID-19 tracing apps are complex, and they incorporate issues of privacy, trust, and security, app efficacy, case numbers, and lived experience. Understanding how these factors shift and change with the dynamics of countries, cultures, and case numbers will be our next step. I hope to keep you all informed of how that goes into the future. For now, that's my time. I've been Paul Garrett. You've been fantastic. Thank you for listening. Thank you to all these people who made this work possible. Have a great day.